The Indian capital, New Delhi, has entered a 6-day lockdown as daily cases of COVID-19 hit a new national record. Crowds queued outside shops to stock up on essentials before the restrictions took effect. The hospital system in Delhi is struggling to cope with the recent surge in cases. The city of 20 million people now has less than 100 critical care beds available. India recorded 270,000 new infections yesterday. The rapid rise in cases has prompted the government to open its vaccination program to all adults from next month. For more on this, I'm joined now by Dr. Vinny Kontru, who's a respiratory medicine specialist who's been working in the COVID ICU ward at Apollo Hospitals in Delhi. Dr. Kontru, thank you for joining us, and you've just come off shift. Describe to us what you're up against at the moment.
Yes, thank you so much, and a very big namaste from here in India. It's very hot here at this moment. We are in the midst of a hot summer. And with the surge in COVID-19 cases, definitely it is very taxing in terms of physical health as well as mental health, both for the patients and their doctors. So there is a surge in the cases, as everybody is aware. The reasons may be many, but we have to take this head on, and we are trying to do that at our level best.
Yeah, and you're working for hours in PPE. And how are you faring with ICU beds there and also access to oxygen?
Definitely, these decisions are very difficult at this moment. We have to triage patients and who to choose, who not to choose. The triaging decision is becoming difficult at this moment. And, definitely the ethical issues would arise when there would be more people pouring in rather than the number of beds. Luckily, it's still not that kind of worse situation. And with the lockdown happening now for about few weeks, I do feel that the numbers might come down, though in the heart of hearts, I do really pray that the numbers should go down. Yes, definitely.
Tell us a bit more about those numbers and this surge in cases that prompted this next lockdown.
Well, we had a very, contained numbers in the winter back here in Delhi and across the country. So we did think that we have partially won over the war against COVID-19. But as everybody knows by now, that no science and no sane thinking is kind of defeating this deadly virus. So we have a surge in cases, and the causes could be many. One of them is, of course, the fatigue which has set in the people. People can't actually, for their whole life, stick to not having social gatherings, having to wash their hands very frequently after every few seconds, maintain the physical distancing, and wear mask every time. It is difficult to be in the mask every time and not go out of the house, whether it is for earning your daily bread or for your social reasons. It is the fatigue which has set in, and people will really go out. The other reason I think most probably is that because of the mutants, the virus is defeating every possible science, and also the vaccination drive which has happened here in India. There may be an immune escape which is happening at the virus level. The virus has mutated already, and the vaccine is not creating that possible kind of level of immunity which is required to defeat this virus. The other factors I feel would be the change in temperatures. We have influenza which becomes more aggressive during the winter season. And here we have COVID-19, which can be more aggressive during the summer seasons. One of the reasons being that we use the air-conditioned environments in summer season, and hence, in the indoor environment, this kind of virus is known to spread very fast. So these are few of the reasons which can be the cause. But of course, there are certain things which we don't actually know about this virus. And we need some few more researches and in-depth knowledge of the virus. Yes.
So working in these conditions, Dr. Kontru, and with these new strains, as you say, are you worried about your own health in these circumstances?
Yeah, definitely. Why not? I mean, more than my health, I am worried about my parents, whose age is more than 70 now. Although I have vaccinated both of my parents, but I'm worried that, I might carry the virus back home and give them an infection. It's really worrying, It is, yes.
Is the government taking steps to scale up ICU beds and oxygen, and how much of a difference will that make?
The government has been proactive about creating more beds and ICU beds, as well as scaling up the oxygen plants and curtailing the supply of oxygen to non-essential services. That has been happening, but the systems do get overwhelmed with this kind of pandemic, where the number of people requiring these facilities is much more than what your current situation and your resources are. I think we have to fight this virus in a longer term, and thinking for future, and create such kind of facilities where we would have more number of infrastructure and facilities available to take care of these increases and surges. So I do feel this is going to come back again and again. And in every part of the country, we have had to face such kind of situations, including the United States, that is already a developed country. They also had to face a very bad situation considering the acute surge which happens. And it can create problems with such kind of, advanced systems as well. So definitely, a little bit of laxity here and there can cause problems, but I'm sure every one of us will get up and create situations where we are able to fight this pandemic on a larger scale, and in a better manner.
In treating the patients there that are coming into ICU, how is the drug, the steroid remdesivir, being used there?
Definitely the critical patients who come into ICU who are already hypoxic, we do have to use remdesivir and steroids. Steroids do have benefits in COVID-19 severe cases and also in moderate cases who are on oxygen. So I have seen very good results with steroids and remdesivir both. But there are few people who are actually not responding to these kind of treatments as well. So the research has to have a faster pace now in terms of creating a drug, which has to be a wonder drug, which can contain the pandemic, and get it low back again. And I do feel we have to increase our vaccination drive as well. The government has already, taken off the restrictions that who can have the vaccination against COVID-19 here in India and who cannot have. So here we have opened the vaccination to everybody who is 18 and more than 18 years of age. So it's open to everybody now, which is a very good step. And I think the fear in the public, which is there against the vaccination, has to go off, and we have to create such a kind of awareness amongst the people that even if they get the disease, the COVID-19 disease post their vaccination, it is going to be less severe in case of vaccinated than in the people who are not at all vaccinated.
Yeah,
so I think people
Sorry,
have to take this. People have to take this fear off their mind that vaccination is not helping at all. So this is a known fact that even influenza virus doesn't prevent the disease wholly. It's the severity of the disease that is actually prevented. So people should know that severity does go down by using vaccination.
Yeah, and with that vaccination open to everyone, of course, that is key. Dr. Contra, are there any constraints on people being admitted to hospital there based on their income in any way?
Sorry, I didn't get you. Can you repeat it?
Are there any constraints on people being admitted to hospitals there based on their income?
No, actually, not based on their income, actually. Whosoever is coming to our center, we are a tertiary care premier center here in New Delhi. The numbers are such large, and it is not their economic status which decides whether they get into the hospital or not. It is the first come, first service basis. Whosoever comes, we are admitting them.
Dr. Vinny Contru, thank you so much for joining us there from Delhi in India.
Thank you so much. Thanks.